Joanne, you've been a nurse for 10 years.
Yeah.
You're in a small trust, 15 intensive care beds, you've got children.
Yeah.
How was the weekend? How are you dealing with what you're seeing?
So I worked 2 long shifts, Saturday and Sunday, and the best way I can describe it is just unprecedented, just awful. We are so busy and exhausted. I'm absolutely shattered today. This is my day off, and it's nothing like we've ever seen before.
Tell us what's happening there. Is every single person in your unit somebody who's suffering with coronavirus at the moment?
I would say 99% are positive for coronavirus, yes.
Joanne, one of the most difficult things for all nursing staff, doctors, is that normally when people are critically ill, you're able to see relatives, they're able to see their loved ones. There's a kind of intimacy about that relationship as people are facing life or death. Here, the most brutal part of this, it seems, other than people actually living or dying, is the lack of any intimacy. This poor little boy, Ismail, who was 13, who couldn't even be buried with any of his family there, had to die alone. I mean, it broke my heart. And this must be happening all over the country.
Sorry. I mean, the hardest thing about the job is looking after people who are immensely unwell. Critical care, intensive care is where you come to us, where you are immensely unwell. And our relationship with the relatives is so close because most of our patients are intubated, so we have no feedback from them. So everything that we do is with the relatives. And at the moment, everything's through the telephone, and made even worse by the fact that we're wearing the masks, which, I'm happy to do. It's fine. It's the sacrifice we make. I'm not bothered. But when you are trying to convey emotions and speak to somebody and you have a muffled voice and you're trying to shout loud, you can't, and you can't give them the verbal cues. You can't read their verbal cues. And just listening to people on the telephone crying is just, it's heartbreaking. I can't describe it as anything other than that.
And Joanne, you are there not just as a nurse, but you are there as the family's representative, because they cannot be at the bedside of their loved one. I mean, that is an extra responsibility and load for you, isn't it?
Yeah. I mean, relatives will say to you, please, can you pass on a message? Like say, I love you, and please get better soon. We want you home. And it just is. It's heartbreaking. I can't think of another word to describe it. I think I cried about 5 times at work yesterday because I feel so desperate for the relatives. I feel so desperate for them.
We've had personal experience of this. One of our co-presenters, Kate Garraway, her husband Derek's very sick in a London hospital, and so been speaking to her, and it's, she's just in the same position as so many other people. But one of the problems is that you're all so busy. No one's able to spend the time they'd like to inform people. They can't go to the hospital. They feel completely powerless at home. And, all our thoughts, obviously, with Kate and Derek and the family.
Oh, absolutely.
I want to bring in Dr. Alex. It's been described as a war zone. You're in a busy hospital down in Lewisham in South London. Would you describe it as that?
Good morning to you all. It's getting so busy now, and to be honest, when you go to work, you are in many ways, I think, preparing for battle. I think emotionally, in some ways physically as well. When you get there, you're going into A&E and you are seeing what is really very difficult situations. You're seeing people who are incredibly unwell. We are obviously doing our best for everyone, but you are seeing people dying of the coronavirus, and that's very, very difficult. And I would echo what Joanne said there with regards to the family. We're not able to let patients see their family, even if they're really, really unwell in A&E, which is very difficult because it's our natural instincts to want to to comfort the family, comfort the patient, and make those situations as as comfortable as we can. We're not able to do that really in the way we want to, which is heartbreaking.
Dr. Alex, Joanne says that 99% of those currently in her ward are coronavirus patients. I mean, is that what you're seeing at A&E? And are you concerned that people are staying away from A&E who perhaps do need to come in for other reasons?
Well, I think the hospital has done fantastically from managers to consultants and downwards. We've split the department into two. So we've got a green part of the department and a red part of the department. So coronavirus or suspected coronavirus cases versus other unrelated health conditions. And of course, we are still seeing people having heart attacks, having strokes, having other serious medical issues that we need to care for. We're also having this added cohort of patients, obviously, who are coming in with suspected coronavirus. So we are becoming busier and busier, and the pressure is mounting. I would say we're coping very well at the moment. I think the system that we've created in the hospital has made streamlining and seeing the patients as quickly as possible really effective. But yes, we're seeing a huge number of cases. I mean, in 1 hour, I think we saw maybe 4 to 5 blue light cases of coronavirus last week. Which is, the sickest patients essentially coming in via ambulance. And that's a lot of pressure, because bearing in mind those who are coming in most unwell might need to be intubated, which requires a lot of input from different specialties and a huge amount of care and attention. So, yes, it's really difficult. And
How worried, Alex, are you about your own personal safety? Because you're now reading, like we all are, about people in the health service on the front line dying. Midwives, doctors, nurses. This is happening.
I think anyone who says that they're not concerned about catching coronavirus is not being completely open, because, of course, we're concerned. For the vast majority of those who are young and fit, it is a mild to moderate illness, but that's not a guarantee, as we've seen over the last few days with some of my colleagues, passing away, and the tragic loss of young John, who's 23 years old, a nurse. It isn't guaranteed that you're going to have a mild to moderate illness, and we know that throughout this this battle, that we are probably going to lose more colleagues, which is frightening. It is frightening, but we know that we have a job to do. We trained as doctors, as nurses, as physios, occupational therapists, and so on, because we want to help people, we want to do our bit in times like this, and we're doing our best. But it is really important. I would say that it is absolutely heartbreaking when you see people not following the guidance. The vast majority of people are, but it is the only word that you can describe it as is heartbreaking. I drove past Clapham Common the other day to work, mentally preparing for what we'd see in A&E, and I saw people, lying out and sunbathing. And if they knew the risks and they could see through our eyes and see what we could see and feel what we could experience in A&E, they wouldn't do it.
Joanne, do you go along with that?
Yeah, if I could just echo everything that Alex has just said. For me, it's the same thing. We're seeing younger people who are normally very, very fit and well, who are being struck down and becoming very unwell. Obviously, when they come to us, they're at the worst. And when you hear about NHS staff dying, it's like one of our own, one of our family has died, and it really hits home. It's like a punch in the chest, because we are going to work, putting ourselves out there on the front line, and when people are flaunting the advice they are given and just going out without a care, it feels like it's a slap in the face. And everything that we are doing, the hard work we're putting in, going above and beyond, it's almost like they're saying, they're just, so what, it doesn't matter.